Now quickly trying to look at the next bone, okay, in the head and neck, which should be talking about its anatomy, trying to look at its position, also the importance of this bone. So this is what is known as a vomer bone. Vomer bone. So vomer bone is more of like this soft part of your nose. Behind the soft part of your nose, you have this bone that is there, okay, that is not always being celebrated, but it's always there to support your nose, and they call this bone the vomer bone. So vomer bone is generalized as a thin, it's a flat bone, and it forms part of the nasal septum. It divides the nasal cavity into the left and the right sides. So location is at the midline of the nasal cavity between the ethmoid bone above and the maxilla and the palatine bones below. The shape doesn't really have a constant shape. You can't really say it is this. So it's irregular bone, is plow-shaped, like all those things that they use in agriculture to now harvest the ground. Cattle will be pulling it. Do you understand? So it's kind of like a plow. Key features: he has a vertical plate. He has a superior border articulates to the perpendicular plate of the ethmoid bone. Has an inferior border rests on the nasal crest of the maxilla and the palatine bone. Have the posterior border, which is free and separates the choanae rather. So choanae. Okay. So also have the anterior border articulates to the septal cartilage. Okay. So articulations, upward joins to the ethmoid bone, at the back with the sphenoid bone, maxilla and the palatine bones beneath it. They will also have the septal cartilage in front. So functions: it actually forms the posterior and the inferior part of the nasal septum. It helps to separate the nasal cavity into two parts. So this will now aid airflow and support the mucosa. Clinical notes is, you could have a deviated septum. So the vomer could be involved in septal deviations leading to breathing difficulties, and there's a surgery where they do there, also known as septoplasty. They do it to reshape the vomer. Okay, its thin structure makes it vulnerable, to displacement if there's so much trauma to your face. So that's what we got for what the vomer bone is and basically its anatomy.